Hello viewers, my name is Damilare. In this lesson, we'll be rounding off the topic homeostasis. In the previous video, we have looked at kidney as one of the homeostatic organs. And now we're finalizing it with the remedy to unhealthy conditions of the kidney. When the kidney is not healthy, what are the things that can be done as remedy? If you want to remember, you can use the mnemonics WURID, sounding worried. WURID. W is for water therapy, meaning the person should drink about 8 to 10 glasses of water daily. Then letter U, ultrasound wave therapy. This is to crush kidney stone when you pass ultrasound wave to the kidney stone, so it is to crush the stones. Then R, rest. The person needs to rest. I, infection. What causes the infection should be removed. Then D, diet. The person should minimize intake of protein. Another thing we look at is kidney failure. When we talk of kidney failure, it's a serious health condition arising from inability of both kidneys to perform their functions. Once kidney is not performing its function, it means it has failed. This could be caused by diabetes, injuries, chemical poisoning. To remember this, use the 3 letters DIC, just like Dick from dictionary. And the remedy to this is dialysis, using kidney machine to wash the blood, doing the work of the kidney, or kidney transplants, changing the person's kidney to a new and a better one. So now we'll be moving to liver, another homeostatic organ. What is a liver? It's a vital organ of 1.2 kg. That's the weight of liver, and it lies below the diaphragm. Remember, diaphragm is below the lungs. So when you have the lungs on the left and right, you see the diaphragm beneath it. So below this diaphragm, we now have the liver, and this liver is at the right side of the abdomen. It's overlapping, or we say it's covering the stomach. So stomach is underneath the liver. The color of this liver is dark red and is in lobes. Now let's look at the functions of liver. How will you remember the functions of liver? You can say happy birthday, silver, but the spelling of the happy, we take it as HPPP. From once you see the HPPP, you remember the happy. Then the silver, the normal spelling of silver. Then birthday, we take only letter B, only letter B for the birthday. So but the spelling of silver, the E there will be missing. So silver, just remove E from the silver, then B for birthday. So the H is talking about heat, meaning that liver can produce heat. Why is it producing heat? To maintain body temperature. For example, when everywhere is cold, the heat should be generated, and that's the work of liver. Then letter P, we talk about protein, meaning that liver can help to regulate blood protein. Maybe you are eating too much protein, which will turn to amino acid. So the excess of this amino acid will be regulated, or use the word deamination. That means you split the excess amino acid into amino group and carboxylic group. This amino group is actually poisonous. It's poisonous, but once the liver converts it to urea, the urea is harmless. Then the carboxylic group, this one will be processed into carbohydrates. Then the liver will store it as glycogen. Then another letter is still P again, which is poison, meaning liver can help to detoxify, that means convert poison into something that is harmless. For example, those that take drugs, alcohol, these are poisonous, but liver will help to detoxify, that means to break the harmful effects of these substances. But when it is too much, the liver will stop functioning effectively. Now we still look at another letter P. Don't forget, we have looked at P for protein, we have looked at another P for poison, then we have looked at H for heat, and we'll be taking another P from HPPP in 3 places. The third P we talked about another protein. That means liver can still manufacture protein. The other time it was regulating the protein, but now it's manufacturing it. What are the proteins that can be manufactured? We have fibrinogen, prothrombin, globulin. These are proteins for blood clotting. Maybe you have injury. What will stop the blood from flowing are these proteins, fibrinogen, prothrombin. They cover it. So that is another function of the liver. So from HPPP, happy, birthday, letter B, then that's the next letter, which is bile. Meaning liver can produce bile. As you know, bile is from gallbladder. It's also something that is bitter, a bitter substance. And when it is being produced, it will be transported through duodenum. Duodenum. It will be transported to the duodenum through a bile duct. That means the passage of bile. What is the function of this bile when produced by the liver? It is to emulsify fats. That means make fat to melt. So for emulsification of fat, from the word emulsion, just like a paint. Then this aids digestion. Now another thing we'll be looking at is silver. We have looked at HPPP from happy. Then we have looked at B for birthday. So now we'll be looking at silver. So the first letter is S. S is for sugar. Meaning the liver can also regulate blood sugar. If there is too much sugar in the body, talking about the glucose. So this liver will convert that glucose to glycogen. And this is the work of pancreas releasing insulin so that this sugar, glucose, can be converted. Then when there is not enough sugar again, the glucose that has been converted to the glycogen will be reversed back to glucose using glucagon. The other time it was pancreas releasing insulin, but now it's glucagon that will do the work. Another letter is I from silver. So I is for iron. So meaning that this same liver can store iron. Where is the iron coming from? Breakdown of red blood cell. When red blood cell breaks, remember, every 4 months red blood cell will die, and when it dies, iron will be produced. So that iron will now go to the liver for storage. Then letter L is another thing that liver can do. What is the L? L represents lipids. L stands for lipids, meaning that liver can regulate lipids. Liver can regulate lipids, talking about fat and oil. How will liver regulate these lipids? It will convert the lipids, normally fat and oil, it will convert it to glucose. It will convert it to glucose, and then it will oxidize it so that energy will be formed by respiration. So meaning liver can regulate lipids. Then letter V, vitamins, storage of vitamins, meaning that liver can store vitamins like vitamin A. This is gotten from carotene. Then remember, from the spelling of silver, I told you E will not be there, but we'll take the letter R, meaning that the liver can break red blood cell, breakdown of red blood cells. Any red blood cell that is worn out, the liver will break that red blood cell. Now from this same silver, we'll put another extra R in our spelling. Remember, from the spelling of silver here, I put only one R. We can add extra R, meaning that liver can also be taken as a reservoir of blood. Reservoir, meaning that where there is enough blood, because there are many capillaries in the liver and blood spaces with a large volume of blood. And take note that blood, where it is formed, is normally formed inside the bone marrow for adults, but for children or babies, the blood formation, let me say the embryo, the baby inside the womb, so it is at the liver. So these are the functions of the liver. Now we round up this topic with diseases of the liver, meaning that what are the diseases that can occur to the liver? How can liver be affected? So if you want to remember, just take MSc, then CH. MSc, like someone that did Masters of Science in Chemistry. MSc, CH. The M is talking about mellitus, diabetes mellitus. Then the letter S, that's stones. So we can remember gallstones. Then the letter C, cancer. We can remember cancer of the liver. Then another C, cirrhosis of the liver. Then the H, that's hepatitis. We can remember infective hepatitis. So MSCCH. Let's start with the mellitus, diabetes mellitus. This is the inability of liver to convert excess glucose in the blood. Meaning when there is too much glucose in the blood and the liver is not able to convert that excess glucose in the blood to glycogen, it means there will be diabetes mellitus. That means too much sugar in the blood. Then another thing we can still get from the knowledge of diabetes mellitus is that it can cause muscular weakness. Why will there be weakness? Because the excess sugar is unable to convert to glycogen for use. So meaning that the person that is having this diabetes mellitus will be weak. And another thing is that the excess sugar will still begin to waste. It will be wasted. So, and since it is being wasted, then there will be no strength for the person from the glucose. Another thing is blood vision. Someone that is having diabetes mellitus may not be able to see clearly, so it can affect the person's eye. And weight loss, the person can lose weight. What is now the remedy? The remedy to this diabetes mellitus, the first thing, use diabinose. So what is this diabinose? This is just what can fight against diabetes. So just like anti-diabetes. Then another thing is injection. Give the person injection, insulin injection, because what the person lacked was release of insulin by the pancreas to control the sugar level. So give the person injection of insulin so that you go and control the sugar. Then the person should avoid carbohydrates, because the more the carbohydrates, the more the sugar or the glucose. Now the next letter we'll be looking at is letter S. So, and letter S, we can call it stones. That's gallstones. So these gallstones, it is formed in the bile ducts. That means the passage of bile is called bile ducts. So from this passage of bile, there can be a growth, something growing like disease, so blocking the passage of that bile. So we call it gallstone. And the reason for this growth is cholesterol. Maybe one is taking too much cholesterol, so it will cause a kind of stone in the bile ducts. Then another thing is it can lead to obstructive jaundice. So jaundice can also occur in the person's body. So that is for the gallstone. And another thing we can look at is the effects when someone is having gallstone. What will happen to the person? The person's skin will be yellow, or eyes will also be yellow. So you have yellow skin, yellow eyes, just like jaundice. If you want to know it, someone that is having jaundice, the eyes will be somehow yellow. Then inability to digest fat and oil. When fat and oil is eaten, the fat and oil will not be able to digest, because remember, bile normally emulsify fats. Now that there is no way for bile to go out, then fat and oil will not be able to digest. Then the person also will be weak, general weakness, because the fat and oil will not be able to break down to release energy. So what's now the solution? That's drug. You notice that most of the remedy to all these diseases, drug will always be there. Oral feeding, so taking certain things through the mouth, and that's the bile acid. You take bile acid that will melt the stone. So you take the bile acid, which will go and melt the stone. Then finally surgery. That means you cut the bile. You cut the bile so that you can remove you cut the gall so that you can remove the stone. You can remove the stone, or the liver itself, to remove the stone. Now the next letter is letter C, which is cancer of the liver. Cancer of the liver. When someone that is having cancer of the liver, what will happen? there will be distorted liver. The liver will be affected in shape, so there will be distorted liver. In terms of the cell they will not look healthy again. Let me show you a picture of unhealthy kidney. Look at this kidney now. You can see it is distorted, it's having disease. So that's to tell you about how unhealthy kidney looks like, what it looks like. So now let's continue with the diseases of the liver. So from the mnemonics, we are still using MSC. We have looked at M for diabetes mellitus, S we have looked at gallstone, now C cancer. Now cancer of the liver, we said when the liver is distorted, that means the shape is affected, so it shows that there is a cancer of the liver. Now what will be the effect when there is cancer in someone's liver? The person will be weak. Most of the effect of all this liver disease is weakness, because there will be no access to the use of sugar. So or maybe the sugar should be wasted, or unable to convert. So there will be weakness, body will be exhausted, that means the person will be weak. Then another thing about this cancer of the liver is that when someone is having cancer of the liver, so it will affect the remaining organs. So therefore the person can be feeling some feverish condition. So the last one from this, after MSC, we have CH. The C is cirrhosis of the liver. When the liver cell is damaged, we call it cirrhosis of the liver. So it will be replaced by dead and useless fibrous tissues, meaning that the normal liver, the fine liver, will become rough. It will look rough. So when it is rough, we call it cirrhosis, especially those smokers. So their liver become damaged, so damaged liver cells, and it will put on fibrous tissues. So that is for the cirrhosis of the liver. Then what will now be the remedy? The person should avoid alcohol, because it was the alcohol that brought that fibrous tissues that is useless, that caused um, the dead liver. So the person, they can do surgery for the person, or you should change the person's liver. So we call it liver transplant. So here we round up the topic homeostasis. Thanks for listening.